In this video, we are going to cover the causes of seizures in epilepsy and the basic mechanisms of what happens within the brain with respect to seizure pathophysiology as well as the mechanisms of epileptogenesis. But before I dive into that, let's do a quick recap of what we covered in the last introduction video. Let me describe a few terms yet again for better understanding. Paroxysmal means occurring in sudden fits, and hypersynchronous means synchronous firing of many neurons all at once. So, seizure is a paroxysmal event due to abnormal, excessive, hypersynchronous discharges from a collection of CNS neurons, which can have manifestations from sensory, motor, autonomic to psychic. Sensory symptoms like paresthesias or flashing lights, motor manifestations like convulsions, autonomic like flushing, sweating, and psychic like unusual intense odors or sounds. Epilepsy is a clinical phenomena rather than a single disease entity and can be explained as recurrent seizures due to a chronic underlying process or two or more unprovoked seizures. Unprovoked because there is no observable underlying detectable investigational abnormality other than an EEG abnormality, which can be corrected like an electrolyte disturbance, CNS infection, tumor, or hemorrhage. Hence, if a person experiences a single episode of seizure or recurrent seizures due to correctable or avoidable circumstances, the person does not necessarily have epilepsy. And that's why we should first rule out all the possible causes which can cause a seizure or seizures and then establish a diagnosis of epilepsy. Now, coming to the big question, what causes a seizure? So, whenever there is a shift or a disturbance in the normal balance of excitation and inhibition within the network of CNS neurons, such that it favors a sudden onset net excitation causing synchronous firing of many neurons at once, one experiences a seizure. We will look at the factors determining why certain conditions may cause seizures or epilepsy. There are three main factors. The first, the normal brain is capable of having a seizure under the appropriate circumstances, and there are differences between individuals in the susceptibility or threshold for seizures. For example, seizures may be induced by high fevers in children who are otherwise normal. However, seizures due to high fevers, that is, febrile seizures, occur only in a small proportion of children. This implies that there are various underlying endogenous factors like genetics that influence the threshold for having a seizure. Also, the brain appears to have different seizure thresholds at different maturational stages. Number two, there are certain conditions that have an extremely high likelihood of resulting in a chronic seizure disorder, like severe penetrating head injury, stroke, infection, and abnormalities of CNS development. The third factor, seizures are episodic. Patients with epilepsy have seizures intermittently, which suggests that there are important provocative or precipitating factors that induce seizures in patients with epilepsy. Factors like psychological or physical stress, sleep deprivation, hormonal changes associated with menstrual cycle, exposure to toxic substances, and certain medications. To conclude, many causes of seizures in epilepsy result from a dynamic interplay between endogenous factors, epileptogenic factors, and precipitating factors. I think at this point it would be useful to mention the specific etiologies of seizures. I'm adding these to the slides. These are age-related etiologies, the most common ones being trauma, intracranial hemorrhage, or cerebrovascular disease, CNS infections, brain tumors, and electrolyte disturbances. Please take a minute to go over the slides listing the causes based on age and drugs and substances that can cause seizures. Let's learn about the genetic causes of epilepsy, which is a recent progress in epilepsy research where mutations have been identified associated with a variety of epilepsy syndromes. Although all of the mutations identified to date cause rare forms of epilepsy. Many of the inherited idiopathic epilepsies, meaning the relatively pure forms of epilepsy in which seizures are the phenotypic abnormality and brain structure and function are otherwise normal, are due to mutations affecting ion channel function. So, those epilepsies which were thought to be idiopathic and inherited forms have been found to have defective ion channel function secondary to genetic mutations. So, these epilepsy syndromes are part of the larger group of channelopathies causing paroxysmal disorders such as arrhythmias, periodic weakness, and familial hemiplegic migraine, etc. On the other hand, mutations seen in symptomatic epilepsies, like neurological abnormalities like cognitive impairment coexisting with seizures, are also associated with pathways influencing CNS development and function. Chromosomal microdeletions may also be a cause behind these syndromes. I'm using two examples here, like the one of nocturnal frontal lobe epilepsy, which has its gene locus on chromosome 20q13.2 and serves the function of nicotinic acetylcholine receptor subunit. A mutation in this can cause alterations in calcium ion flux through this receptor, reducing the amount of GABA release in presynaptic terminals and causing seizures. How is a seizure initiated and propagated? Focal seizure activity can begin in a very discrete region of cortex and then spread to neighboring areas. There is a seizure initiation phase and a seizure propagation phase. The seizure initiation phase has two events occurring at the same time in a cluster of neurons. The first event is marked by high frequency bursts of action potentials. These bursts of action potentials are caused by long-lasting depolarization of neuronal membrane. Why is there long-lasting depolarization? Because of influx of extracellular calcium ions into the neuron, which in turn leads to opening of voltage-gated sodium channels, leading to an influx of sodium ions, which generates repetitive action potentials. So, to sum it up, the causes or etiologies mentioned earlier lead to the generation of these repetitive action potentials via a long lasting depolarization mediated by sodium and calcium ions. And since this activity occurs in a repetitive manner all at once, we have the second event, the hypersynchronization. So, we have hypersynchronized high frequency bursts of action potentials being generated, marking seizure initiation. This is followed by a hyperpolarizing action potential, which is when the neuronal membrane's potential falls below the normal resting membrane potential, giving a refractory period in which the neurons are unable to generate subsequent action potential. This hyperpolarizing action potential is mediated by GABA receptors or potassium channels depending on the cell type. The whole event of hypersynchronized bursts of action potentials is seen on an EEG as a spike discharge. This covers seizure initiation. After this, how does a seizure propagate? Normally, the spread of bursting activity is prevented in normal neurons by hyperpolarization, like we already discussed, and a region of inhibition created by the surrounding inhibitory neurons. But with sufficient activation, a number of neurons are recruited via many synaptic as well as non-synaptic mechanisms like increase in extracellular potassium, accumulation of calcium, activation of NMDA receptors, etc. This leads to loss of the surround inhibition effect. That is, activation overtakes or dominates inhibition, and we have the propagation of seizure activity into contiguous areas. Now, the last subtopic, mechanisms of epileptogenesis. Epileptogenesis refers to the transformation of a normal neuronal network into one that is chronically hyperexcitable. There is often a delay of months to years between an initial CNS injury and the occurrence of the first seizure. This injury initiates a process that over time lowers the seizure threshold in the region of insult until a spontaneous seizure occurs. However, in many genetic and idiopathic forms of epilepsy, epilepsy is determined by developmentally regulated events. Some studies of the hippocampus in patients with temporal lobe epilepsy have suggested that some forms of epileptogenesis are related to structural changes in neuronal networks, like a highly selective loss of neurons which will cause inhibition of the main excitatory neurons, plus reorganization or sprouting of surviving neurons. This structural change will affect the excitability of the neurons, giving them a lower threshold region which is chronically hyperexcitable. To conclude, epileptogenesis probably results from long-term alterations in intrinsic biochemical properties of cells within the neuronal network involved. This covers everything related to the causes, pathophysiology, and mechanisms of seizures in epilepsy. In part 3, we'll cover the classification and some important types of epilepsy. Thank you so much for watching.